Welcome back to the Noon Show on WBAY TV2. This is Ask the Expert, and this is a familiar face. Dr. Kurt from Tower Clock Eye Center is with us. It's great to see you, Doctor.
Same to you, Nick. Thank you.
When it comes to treating glaucoma, eye drops, it's pretty common to treat it with eye drops, and you have a potential game changer at Tower Clock that can not only help an individual stay on task and stay on target, but can be cost effective as well. It's the compound eye drops. Let's talk about this.
Yeah, this is a relatively new, very interesting development in our field. As a glaucoma specialist, you're right, we do have to use eye drops frequently to treat eye pressure to help bring it down. It's analogous to using blood pressure medications or diabetic medications. But for most patients who have glaucoma are going to have to use eye drops to bring their eye pressure down. It might be 1 or 2 drops. Some patients have to use 3 or 4 drops or more throughout the day. So what's available now are drops that are available through what we call compounding pharmacies. These are independent companies. These are pharmacies that are certified to mix their own cocktail of medications. So instead of the patient having to use 3 different bottles at home, these companies are able to put all those medications into one bottle, kind of customize it for the patient. And then they're also creating preservative-free formulations of all these drops. So patients who have to use all those medications oftentimes wind up with red, irritated eyes. There's a lot of cost involved. There's a lot of hassle. Boiling it down to 1 eye drop, maybe once or twice a day, is really wonderful.
And by cutting down on the human error, which is so common in medication, you know that you're truly treating that patient with what they need in that moment.
Absolutely, and cost is a huge factor. So the one catch with these medications is that they're not run through insurance companies. So it is something that the patient pays directly to the compounding pharmacy. But even with that, almost across the board, it's much more cost effective for the patient to do that than to continue paying their copay or to pay down their deductible on their medications. So it's, doesn't matter to me how the patient gets their medications as long as they're getting them, as long as they're using them. But when we present them with this option and say, hey, look, think about this, once they do the math, it makes a lot of sense.
Beneficial not only for the patient, but as the individual who's treating that patient. You know, if they walk through your door again, exactly what you're getting into.
Absolutely.
To find out if you are a great candidate for compound eye drops, or to have any questions, if you need to talk to the folks at Tower Clock Eye Center, Dr. Kurt and the entire team is available by following the information right there on your screen. It's always available by going to WBAY.com and clicking on Ask the Expert. Thanks for being here today, Doctor.
Thank you.
We'll get you back into the Noon Show.